My name is Daniela Flores, and I will be presenting to you guys the importance of wearing a mask. The world gave a 180-degree spin when we were hit by a worldwide pandemic. Let's face it, no one was prepared for this at all, you know? Many of us lost social events, vacational trips, conference trips, and jobs, and unfortunately loved ones as well. This year has been very drastic, and we were shut down for approximately 2 months. And the stock market crashed as well, multiple times. Who was at fault? You guessed it, COVID-19. Did you know COVID-19 is how it affects your body and what it is if you don't keep on listening? Because COVID-19 is a serious illness that we have taken for granted. We can avoid all of this by washing our hands, following the social distancing guidelines, and wearing our mask. Unfortunately, it is way more difficult to be on an oxygen machine and mask than wearing our mask, so quit complaining. I would know this because my son was 5 days in the hospital with an oxygen mask and machine connected to him. He had no solids. It was horrible, and it's very difficult seeing a loved one, you know? If he wouldn't have had this oxygen machine or mask, it was difficult for him to breathe in it, but it wouldn't have saved his life. Today, we really don't think for others. We just think for ourselves and are a little selfish. How difficult it is for us to breathe in a mask, like various times, while doctors can wear their mask for extended periods of times or even up to 12 hours in surgery. But us and the doctors encourage us to wear our masks to save lives and to stop the spread of COVID-19. That could be prevented by wearing our mask. I could have never thought that the COVID-19 is in fact a very serious illness and could even cause death, not just to seniors, but to all other ages. I'm not here at all to persuade you to wear your mask. I'm here to make conscience of what happens when you don't wear your mask and when you don't wear your mask and you do wear your mask. How can we make a change today? Let's take a look of how COVID spreads and how it affects your body. The COVID-19 spreads when you come in contact with someone who is tested positive for COVID-19, or when you're physically near 6 feet of someone who is positive for COVID as well. Person-to-person transmission occurs when droplets, aerosols, and airborne transmissions and surface transmissions. Let's take a look. The importance of wearing our mask. Person-to-person transmission according to the CDC article. Droplets or aerosols when an infected person coughs or sneezes, and droplets and tiny particles called aerosols carry the virus from their nose and mouth and into the air, and we breathe it in. Airborne transmissions research shows that the virus can live in the air up to 3 hours, and it can stay in your lungs for someone to breathe out and breathe in. Surface transmission, when someone who's positive for COVID has sneezed or coughed in the surface area, you come in contact, you touch your eyes or your mouth, boom, you're infected. COVID-19 symptoms, according to the CDC article. Fever or chills, cough, shortness of breath, fatigue, muscles in the body aches, headaches, loss of taste and smell, nauseous, vomiting, congestion, runny nose, and diarrhea. These could be various symptoms. You can have any symptom, probably one or all of them. Just depends on your body. After more studies and more cases have arisen, the COVID-19 has been confirmed that anyone can be non-symptomatic to moderate symptoms or even severe symptomatic. People of any age or even children can catch COVID-19, but it mostly affects middle age and an older age group. However, our 65-year-olds and older are more more prone to be exposed to this virus and be very, very dangerous for them and even possibly deadly. 80% of the deaths in the US are from this disease and have been people aged 65 and older. This was stated by the Mayo Clinic site. In worst case scenario, COVID can cause death. We know how COVID-19 spreads and what are the potential symptoms. Now let us look at how severe complications to those with severe underlying medical conditions. The risk of developing dangerous symptoms of COVID-19 may be increased for anyone who has a weakened immune system, heart or lung condition, and also diabetes or obesity. They have an underlying medical condition. Now let's take a look. We have stated from the WebMD article, complications from the COVID-19 are acute respiratory failure, pneumonia. We have also acute respiratory distress, acute cardiac injury, and secondary infection. Yes, you can get COVID again. Stated from the WebMD, serious complications of COVID are acute kidney injury, septic shock, blood clots, multi-system inflammatory syndrome in children, only children, chronic fatigue, and rhabdomyolysis. Here we have an example from Stata Demographic. How often does an American use a face mask in the public by percentage? You can see the demographic. Green is always, the bluish color is often, purple sometimes, and orange is rarely, while red is never. And do you see these numbers? We need to change these numbers to prevent the spread of COVID-19. And then we also have the risk of spreading COVID-19, how it works. You see when someone wears a mask and when someone doesn't wear a mask. Let's save lives, people. To conclude, rather than diss the mask, would you wear the mask? The COVID-19 is preventable. You just have to wash your hands and wear your mask. Avoid contact with anyone who is sick or feeling ill. And if you are exposed to someone, stay at home, please. I strongly believe wearing our mask can save everyone's life. We need to stop being ignorant and seek for others, and stop being careless and just wear a mask and save lives and prevent the spread of COVID-19. Thank you for listening.